All right. Hello, everyone. Thank you again for joining us today for a discussion with skilled nursing expert and leader Ray Thivierge and Outset Medical Chief Commercial Officer Steve Williamson as they discuss how recent dialysis innovation is enabling skilled nursing facility (SNF) providers to differentiate themselves in a competitive market. We'd love for this to be an engaging conversation, so please feel free to enter questions into the Q&A at the bottom of your screen throughout the session.
Hi there. My name is Steve Williamson. I'm the Chief Commercial Officer at Outset Medical. Thank you all for joining today. I'd like to welcome you to our webinar entitled Revolutionizing Dialysis Care in Skilled Nursing Facilities. Today, I'm excited to be joined by Ray Thivierge. Ray has a long career in the skilled nursing space. And Ray, can you tell us a little bit more about your background and your passion for care in this space?
Oh, absolutely. Thank you. Thank you very much for having me. I appreciate it and appreciate the opportunity to talk about something so important to the sector. I am Ray Thivierge, and I am currently the founder and principal of Lodestar Advisors. We are focused on providing leadership and consulting and advice to the skilled nursing sector, but also those who work with the skilled nursing sector. I've got about 30 years or so in the business myself. I have been in all areas of operations and business development and strategy. Most recently, I was with Sava Senior Care as the Chief Strategy Officer. And before that, I was with Genesis Healthcare in multiple capacities, including Chief Strategy Officer as well for that organization.
Great. Ray, can you tell us a little bit about your experience with dialysis in the post-acute markets?
Yeah, absolutely. Having been in the business as long as I have, I hate to say it, but I sort of predate the prevalence of dialysis services in the sector. The fact of the matter is we've always had end-stage renal disease patients in our settings, and they've always needed care. But the options for them receiving dialysis in particular always involve them being shipped out to a clinic somewhere in the community. And so my experience has sort of seen the evolution, if you will, of dialysis options for nursing home residents or nursing home patients. The early days, really the most advantageous way of trying to meet the needs of these residents with these extra complexities to their care was to be fortunate enough or ingenious enough to have a clinic next door, right? To have a freestanding clinic that maybe served the public, but served the residents within close proximity. That evolved and expanded as technology changed, certainly, but also as the nursing home became recognized for purposes of dialysis as the resident's home. And we became better able to offer options to nursing home residents that had been able to be offered to them through their homes. And so that's a relatively recent development, but it did change the way we've looked at providing care. And so some nursing homes, not many, relatively speaking, but some have built, operations around partnering with dialysis providers to build those capacities, those capabilities in their center, typically in the form of a den. And so I've had the ability and I think the good fortune to be able to work with several providers out there to do that, and work with several nursing homes where we've taken space inside the facility and converted them to dens in order to offer a den-like setting for the services for the residents. So it's evolved, and until recently, options really have been rather limited to the space available in the building and the ability to attract a provider partner, as well as the ability to sort of re-engineer the infrastructure of the facility in order to allow the den.
Yeah, Ray, so we see this evolution in dialysis you're talking about. How about like the evolution in SNFs? As we start from a macro level, kind of looking at the SNF, what are some of these post-COVID recovery strategies that you see the SNFs implementing out there to differentiate themselves in the market? How are they building their census? How are they offering value to the patients?
Well, there are 15,500 and something nursing homes in the country, and many of them have found themselves in situations or in varying situations. So, it's hard to answer a question with that many facilities with a generality, but I can tell you that there are common things. One of the things that we saw, you mentioned COVID, the industry, the sector was particularly hard hit in the area of staffing, as were many other sectors, but in nursing homes in particular, we really felt the sting of folks leaving the sector for one reason or another, and then a harder time trying to get folks back in. That's changing somewhat, and we are starting to see that resolve, but we're still very much dealing with staffing issues that are limiting options, right? And then the other thing is we saw a lot of folks leave our centers, some of them due to death, some of them choosing to go to other settings. But COVID really did decrease our census. And so we found ourselves in a situation where, as an industry, as a part of the continuum, we really were needing to think about how do we continue to operate in some cases. And found ourselves with folks who really are clinically more complex and really needing more care, needing to be in the institutional setting. And so I think what we've seen is the sector leadership has stepped up, and we really have seen a growth in clinical complexity. We've seen folks look at programming and adding programming that required them to have enhanced physician involvement. So a lot of innovation is in the area of physicians and physician involvement. We've seen folks look at and think about, and this is going on pre-COVID, but it's continued post-COVID certainly, the idea of how to better manage and better be involved with and controlling pharmacy utilization. We've seen some companies think about, innovative ways of looking at how to do, and be better able to participate for value-based care in some type of ISNP. So you've seen financial innovation. So I can't think of an area of the nursing home that really hasn't been impacted by, the change in circumstances that COVID brought around.
Yeah, I think is where we hear people kind of expanding their offerings into dialysis as well, and obviously that being a core point of our call today. It might be helpful for us, since it's such a hot button and there's so much attention going there. It'd be great to see who we have on the call today. So why don't we run a quick poll, and let me ask the people that are on the call right now if you could just answer this, and we'll post the results here. But does your facility offer dialysis services to residents today? Yes or no? Can we post that poll? Looks like we're at kind of a 75, 25, 25% of them are doing dialysis right now, 75% aren't. So I think there's like I said, obviously this is a hot button, and there's a lot of interest here. So I think maybe it'd be helpful if we could maybe take a step up and say, okay, what does this market look like? Let's look at the prevalence. Why is this such a hot button right now? Let's take a look at the prevalence of dialysis patients in skilled nursing facilities. Can we put that slide up, Bo? Yeah, so as we look, I mean, we've got these new ESRD patients are being diagnosed annually, 135,000. I think really there's one shocking thing that I want to pull up on this stat on this slide right here, and that's that 85,000 dialysis patients filter through SNFs annually. That is a shockingly large number, I believe, and I think it's one that people don't necessarily realize that many patients are going through SNFs, and I think one of the reasons is because 2 patients per SNF is the median placement right now. So it's a very small population of dialysis patients that are being treated per SNF. And I think we're starting to see some people that are saying, hey, this is a way for us to not only differentiate ourselves with our partners, with patients, with their families, but also from a care perspective as well. So Ray, we're looking at this and we're saying, okay, the data show there's a need for dialysis service lines. And I hear you saying that SNFs are looking at different services to drive differentiation in the market in this post-COVID world. So why don't you think folks are taking more dialysis patients into the SNF? Why do you think we're at this 2 number, despite this growing need in this large patient volume that are out there looking for treatment?
Well, I think first of all, the idea of providing or meeting the need of the dialysis patient, the end-stage renal disease patient, those folks have been in our settings, right? Those folks have been there in small numbers, perhaps relative to the general population, but they've been there. And we've always dealt with that by sending them out. So the transportation issue itself has always served as an extra consideration for whether or not a facility could accommodate the needs of a dialysis patient. It takes extra staff to get the resident ready. It takes extra time to deal with the resident. It takes, extra level of clinical oversight to make sure that the patient got all the medicines they needed while they were out and that they came back having been fed. So there's lots of additional complexities to taking the patient in the traditional environment where you got to send them out. Those complexities remain when you bring the patients in, and to bring those types of patients in on a kind of on a larger scale means you got to have, it's not just the dialysis. These patients tend to be clinically complex. They've got many of them have comorbidities and complex clinical needs. They tend to be many of them have psychosocial needs that are greater than the typical nursing home resident or patient, and a lot of them are folks that have got in particular some higher cost needs, right? So there's a real in addition to the transportation issue and all of the issues associated with the staffing and getting ready to care for these patients properly, there's a real challenge to make sure that we're being compensated, reimbursed for these patients. And so I feel like there's a duplicity to this. We know that the need is there, but it's not necessarily the easiest need for the facility to adapt to. And so I strongly believe that we are, as an industry, caring for dialysis patients on a regular basis. I really also feel, though, that as technology has evolved, again, keep in mind, we've only been 2017, 2018 at a point where, the technology was even at a point where we could be providing these services in the center. We're still adapting to that reality. And if you kind of give pause to understand that during that COVID year or two, everything was paused. I feel like we are just getting started. I do feel that there have been early adopters to providing these services in-house. But I feel like more and more we're going to see folks who want to step up and step in. I feel like the circumstances have been very complicated. The patient need is complicated and the solution is complicated.
So Ray, I totally agree with you there. I think that there's individual circumstances and facility circumstances do differentiate and really drive the need for custom applications. If you're out there and you're one of these 75-80% that don't currently offer dialysis services, what kind of models of care are out there? Like what are your options as you're coming into this and looking to make a decision?
Well, like I've implied in previously, there's really 3 things you can do, right? You can partner with a clinic or multiple clinics in your community, hospital-based or otherwise, to accept the patient and then transport them to the destination they need to get to for their treatment. Or you can invest in building one of these dens in-house and partner with another provider to come in and run that den for you, and help you meet the regulations and help you meet the staffing requirements and all the training that goes along with that. And then now with what Outset is doing through Tableau, there's another option, right? There's this third option to consider, which is the thought of, should this be something that the operator or the operating company can do themselves? So those are the 3 considerations. I think I feel one of the reasons why I really love talking about this is because all 3 of those are viable options. What we know is the numbers that you quoted around folks being needing nursing home care and also needing dialysis. That's only going to increase. We know for lots of reasons that the the ESRD population is expected to increase. And as the Americans themselves continue to age, we expect more of that percentage to be folks who are going to require some level of kidney support, some level of dialysis, perhaps. And so that is not going to change for our sector. It's not going to change for us as operators. And so one of these solutions has got to, all of these solutions have got to be changed. They've got to be considered. And then we have to think about which ones fit best for the situation.
I think, Ray, it's interesting because you've used the word evolution a couple of times. And when you list those three, the first one being you can ship them out, right? You ship them out to a provider, the transportation, all the costs that's associated with it. It might be the easiest to do if you don't have a program in place, but it's probably the most costly and the least beneficial for your patients. So there's that aspect. And then the flip side to it is you can bring in a provider to come in. And really, those were the two options that people have had. I think what we've been focused on in the evolution and innovation that you're talking about is we're giving people the ability to really open and own their own program now. And I think the attendance of this webinar indicates that there's really a lot of energy and space in this area right now. And I think that's exciting because I think people are focused on improving the access to dialysis and the experience that these patients have right now. And in the past, they didn't get the attention that they needed. Now there's an opportunity to really treat the patient the way that they need to be treated. So our team's really been focused at Outset on building a business model that can help the SNF customers build their own programs in a way that addresses the complexities that you've discussed, while also allowing them to deliver, which I think is the most important thing, which allows them to deliver superior care and quality to some of the prior pre-evolved options that were out there before. So I think that's really, it's interesting that we're able to have this conversation now because the technology has evolved to allow and facilitate this. So I think that's terrific. And it's great that people have options.
And very, very, very timely because as I've intimated as well here, the situation of needing dialysis is, a significant complication to one's life, to say the least. To need dialysis as a nursing home patient is really a difficult scenario. And I don't think anybody would say to you, even sending patients out is the easiest way to do it, because it is hard on the resident, it's hard on the staff. Typically, the quality of life is the resident, is not able to participate in the same level of activities. Many times they miss out on other therapeutic regimens. Sometimes they miss out on their pharmacy or their meals. So absolutely, the more solutions technology can provide for ensuring that folks who both need skilled care and dialysis, that the more options that folks have to consider in that regard, the better stewards we're going to be of those residents.
Yeah. I think as people are trying to stand up these programs, and you talk about easy, like how can we make it easier for people to have options and to own their own program? That's really what Outset is kind of come on and say, okay, you've got these complexities that Ray's talked about. And what are the biggest ways we can help? I think there's really three of them. I think the first is staffing. People get concerned about staffing and how are we going to staff the program and can we do that? I think one of the great things about Outset is we've helped hundreds of acute and post-acute customers stand up their own dialysis programs. And what we've seen is kind of interesting. We've seen staff that want to work in internally owned programs. They have a great quality of life. They're not traveling as much. And they actually like being tied to the facility. And so we've seen the number of resumes and applications that come in when these positions open has been alarmingly high and surprisingly high. And I think another benefit, obviously, when you get that staffing is now you start to get this consistent experience for your resident. Right. So that patient is comfortable with this nurse. This is the nurse that they see all the time. They're not being exposed to a bunch of different things that can kind of calm their stress level. So staffing is the first area that we help. Licensing is obviously another big question that people have. Our team can provide the guidance and kind of counseling to get people licensed, get them up and running. and help them ensure that they're compliant with local and state and federal regulations. It's what we do. It's part of our program that we offer to get people up and running. I think finally is kind of startup costs. People are like, well, I don't know, can we fund this? Do we have access to the capital? We work with a number of partners in these programs that we've stood up to offer creative financing, whether it be leasing programs or rental programs, or really whatever the facility needs. We can tweak that offering to meet the needs of the facility. So when I talk about custom programs and solutions, that's exactly what it is. It's customized to the facility. It's not a brochure where we say, hey, go do this, or this is what's going to happen. It's let's take a look at your needs. And it probably seems like a lot. It's like, do I want to stand this whole thing up? I would say the view is definitely worth a climb here. People have stood it up with pharmacies and some other services. Why wouldn't you stand it up with dialysis? You've got these patients, you've got an opportunity. There's a number of benefits from running your own program. Why not take advantage of them?
Well, and based on everything you just said, Steve, in terms of the services that you offer the facilities, that's an exercise that an operator would need to go through on their own, perhaps, as if decided that a good way to differentiate themselves in the marketplace, a good way to partner with their local medical community, a good way to partner with their local hospital, a good way to drive some business metrics would be to institute a program. They're going to have to go through exploration on all the areas you just talked about. And so the idea of being able to do that with a partner and with a model and with sort of a customizable approach seems to be something that would be very welcomed by most operators as they're considering the journey.
Yeah. Yeah, indeed. There's a number of benefits that they can see as they go through and look at this. And maybe, Bo, I don't know if you can put that slide up for me that just talks a little bit about the benefits of owning a program. And there's really, I guess there's 6 that we put on here that it gives you the ability to really treat higher acuity patients. I think that's really important. It lets you build out the census. Let's go to, it helps you build out your census. They can build out your reputation with your referral sources as well. They've got some pressing issues out there. Your referrals, the hospitals that you partner with, length of stay is a big issue for them right now. If you can help them knock down the length of stay problems that they have, especially with dialysis patients, they get caught in their system sometimes. If you can take those on, you really do get seen as a partner, and the hospital and acute systems will look to grow with you. If you're working with a third party right now, there's financial benefits to owning your own program. You're currently not collecting Medicare B. Under this model, we can help you maximize margins for caring for these patients. There's an impact in patient care as well. It's enhanced patient care, and obviously, the numbers I hear thrown around for transportation costs are insane to me, and the ability to save as much money as people are saving by not transporting these patients out, by not having to send somebody with them, by not having to schedule around other people's schedules, has just been astronomical. So there's a number of benefits here, and I think they're important for people to note as they're looking at different models.
I agree, and just in summary of what this slide and what you just said, do you feel, Steve, then that the major differentiator between you and what a provider who would come in and run the clinic for the operator is that the added reimbursement as well as the ability to sort of impact some of the staffing?
Yeah, I think it's 3 things, right? I think you've got added reimbursement helps, right? Everybody wants to see what it looks like on the bottom line. And the good news is we can come in and we'll do a pro forma with you and we'll show you. But I think that the other 2 aspects of it is reduction in costs. So right now, the cost associated with transporting patients or not accepting patients is significant. And then I think the third and most important from the research that we've done and the customers that I talk to is really the ability to enhance patient care. So you've got a financial benefit, you've got a patient benefit, and really you've got an operational benefit. So it's kind of checks all the boxes, I think. And so I would say that's really the reason people should look at owning their own program.
Great.
you want to jump to some questions here, Ray?
Yeah, that's what I was going to suggest.
All right.
Yeah, so the first one I see here is what are the reimbursement benefits of using Outset instead of another provider? I think you mentioned that it's the Part B billing. Do you want to say a little bit more about that?
Yeah, I mean, it really is the Part B billing, right? In many instances, it opens an opportunity for the provider to get the Medicare Part B billing for the dialysis patients. Our team can kind of walk through the pro forma with you. We'll help you build that and show you what it takes in order to actually do that Medicare Part B portion. And we'll pull together the clinical and financial benefits across the board and really build a custom program for you. So the reimbursement benefits are there. They're different for different people. You know, I get the question all the time: how much money can we make if we do this? What will we see? What are the cost savings? And it's really different, and that's why we come up with a custom consultative approach. We will sit down with you and build out that pro forma, show you the cost savings, show you what the revenue opportunity looks like, walk you through the benefits of ownership, and then let you make the decision from there.
Right.
So next question. In your experience, right, what would it mean to be able to build your census higher with higher acuity patients?
Well, you know, it's sort of going in that direction anyway, isn't it? I mean, the idea is that, of course, as you build your clinical acuity, you're able to build your partnerships with the community and with the medical community and with the hospitals associated with them. And so, you know, being able to offer therapeutic modalities that require, you know, a more elevated skill set on the part of the nurses also can attract different nurses to work in your environment. Folks who want to do more clinically complex and more specialized care now have an avenue to do that in the skilled setting. And then I think that's the other reality is that, you know, as we are seeing our hospital partners require earlier and earlier discharges, we're seeing the need for folks to come in and have at least a short stay with us, right? And so the ability to sort of build those relationships with folks who are going to return back to the community once they are clinically stable, that also plays a part of this. And so offering you know, a dialysis solution that can be a part of that formula is something that could very much value the place that the facility holds in the continuum.
Do you think that there's an impact on quality of care if you provide dialysis on site?
You know, we would like to think so, wouldn't we? I mean, a lot of that is going to depend on how the program is running, just like in any other. I don't think offering the program by itself necessarily, you know, improves quality outcomes, but certainly the opportunity to collaborate and to be involved with decisions as a team instead of as a clinic group versus a skilled group, and to be involved with perhaps more of the medical interventions, that all kind of leads to better outcomes, along with better information, better data, faster response times. So yeah, I mean, at the end of this, we would hope that it would lead to both better outcomes as well as better quality of life for the resident, more opportunity to, you know, enjoy life in times that are not focused on either getting to or coming home from the clinic.
Yeah. What about referrals? So how do you think the referrals would go from partners? Do you think this would improve referrals? Does it help drive census?
Absolutely. You know, the reality is right now that most communities don't offer nursing homes that have a dialysis option associated with them. So if one were available and one were able to do so in generating quality outcomes, it's very clear that they would become a facility of choice for the diagnosis, you know, and that gets, you know, that's something that grows on itself as you become more of a solution for your referral sources. So this can absolutely be a driver of referrals if in fact, you know, you're delivering on the promise to the community and to the residents.
No. Right.
I've got one for you here, Steve.
Sure.
Oh, I'm sorry. Yes, I do have one, but it's not for you. It's for me. Do we find that patients will have the energy for rehab? Yeah, the answer is yes. They absolutely do, and in fact, they tend to, especially with inpatient dialysis. You're not further making the day elongated by the complexity of traveling and transporting back and forth. So we do see good positive results. Sorry that I misread that question, Steve. That was for me.
Okay. Yeah, I think we find with Tableau it's a little bit differentiated technology as well. So we have a gentler dialysis treatment that we've found in our clinical data that patients sleep better when they're on Tableau versus competitive devices. They have shorter recovery times, and they see improvement in their physical and mental health. So you can hear it from me, or I would suggest if you look at our webinar or our website, there's a number of patient testimonials on there, and you can actually hear it from them. There's we call it the feel good effect around here, and it's really what we've seen in our home trial is that these patients are doing better. They're sleeping better, as I said, shorter recovery times, and their physical mental health is better, which then allows them to rehab and allows them to do other things rather than sitting around at an offsite facility or in a chair, taking up a chair there for an extended period of time, rather than getting back and getting to whatever else they need to take care of.
That absolutely makes sense.
Here's another one, Ray. So someone asked about average renovation and startup cost and added risk liability. What are your thoughts on that?
Well, the costs, of course, are going to vary depending on which model you go with, and what whether you choose to go with 3-day or 5-day, which is a different level of technology that requires different plumbing and different electrical and so on. And it's also going to vary on depending on the age of the facility and the infrastructure needs of the building, as well as the size of the den you're going to choose to build, or what the size of the space that you're going to use to accommodate the treatment. So the fact of the matter is, for most people, most companies, we see them trying to benchmark an ROI on something like this in the $25,000 to $100,000 range, depending again on all of those variables. So it is something of an investment in the physical plant, typically, as well as you've also got other expenses to consider, like staff training, expansion of your clinical capabilities beyond the den, because it's not just about dialysis. It's about having a renal care program so that you can treat the totality of the patient's needs. And then the risks and the liabilities associated with having that extra set of services in your building. So there are costs associated with it. At the end of the day, all of those things need to be considered and factored into the decision around how to approach meeting the needs of these residents.
Yeah. I think the great news about this is we can do this with you. We will sit down with you and put together exactly what those costs would be for you. I think one of the benefits with Outset and with Tableau is that you don't need a water room. Typically that's a significant expense. So the fact that you don't need that, I mean, we've got it completely built into the system. It's all in one. At the same time, I think one of the big benefits here for Tableau is that it's much easier to learn than traditional machines. We designed this. It's almost like you're training every time you use it. The experience, it's a touch screen that walks you through the procedure. It walks you through the dialysis treatment. It walks you through any issues that come up. It will call your attention to them and give you troubleshooting information at that time. So it's just much easier to use. It's very intuitive. It was designed with kind of a fourth grade mentality in mind. Could a fourth grader actually operate this machine? Now, am I suggesting that it's the same? I'm not. I'm just saying that we designed it to be very easy so that patients can use it in their home. They can use it actually across the spectrum of sites of service. So Tableau is used in the ICU right now. It's used on the floor. It's used in ED. It's used in clinics. It's used at home. It's used in SNFs. It's used in LTACs. It's used in rehabs. So this one machine can be used in all these different areas. It's very versatile. And in order to do that, we really had to make it very easy to learn and easy to operate. And so that's what we've done.
Well, there is an implied benefit there to many skilled nursing facility patients who are going to take advantage of the technology, and that is that it's something they could go home with them, right? The technology could be the same. So as they are adapting to and getting used to their life, as long as it's going to be on dialysis, with families around them to help them, that piece of equipment is something that they can come to learn and understand and become comfortable with.
Yeah, I think that's exactly right. You know, it's amazing if you're looking at, okay, we're caring for this patient, and if you see that patient is actually going to be leaving the facility, the ability to actually send home that patient is really kind of amazing, and it's something that they've trained on, and as they've gone through their process, it really is kind of incredible what the opportunity is. So. There's another question I got here. If SNF billed the same as in-center dialysis, which is $268 per treatment, we have to utilize a combination of RNs and technicians to maximize profit. What would be the nurse to patient ratio? Typically, we would see 1 to 12 RNs to patient, or 1 to 4 techs to patient, but that depends. It depends on what you're seeing in state regulations at that time. Again, we will customize this based on licensure and regulations to make sure that you're compliant, but just kind of a general guideline is that. Ray, anything you want to add to that, or?
Well, just of course, it depends on the practical size of the den that you build, how many treatments you're doing at the same time, and other variables like that. From a clinical perspective, I think the 1 to 12 ratio is something that we have considered in other formulas for doing this, depending on how things all work out. The other thing I would just say is that, regulations around this technology are catching up, right? I think part of the issue that we've had is that, I'm not sure regulators or surveyors necessarily knew how to engage in reviews of these symbiotic relationships between dialysis and nursing homes, and we're getting better and better at that. And I think there's a real recognition of the fact that there's a need that's being met here, that we want to encourage folks to participate in these programs, not discourage them. So I think we're seeing, as technology changes and as we're starting to see the ability to use machines, for example, with more than one patient and those kinds of adaptions, we're being able to, I think about this as a more viable business model, but also a better way to do care.
Yeah. Yep. One of the other questions we got here was kind of, how often do we treat patients? How can Tableau get clearance if we're doing 3 days a week? And the answer, obviously, it's patient specific, but we find a number of patients on 3-day-a-week treatments and prescriptions. Obviously, like I said, it's up to the physician, but we do see strong clearance rates with our product 3 times a week, but we also see people going 5 times a week as well. It just depends on what that patient need is, but absolutely 3 times a week is there's an ability to get clearance there.
That's great.
Anything else on here? Let me see. Any more, Ray? No?
I don't see anything on my end.
Okay. So I guess I'll just wrap it up then. If we don't have any more questions, as we've talked about this, I don't think there's any reason, hopefully we could all agree, that a patient coming from a hospital shouldn't be able to get dialysis in a nursing facility. I think that people on this call actually have a unique opportunity to do something about that, and not only help grow their business, but help their business partners, and most importantly, their patients. And so I guess that's the call to action here is there's an opportunity, there's a need. I think we can come together to address that. As we've discussed, there's a number of different solutions here when it comes to dialysis. What I'm suggesting is that if you own your own dialysis program, it allows you to eliminate the transportation costs, build your census, and generate a new revenue stream. And so that's generalities, but obviously you want to take a look and see what's right for you. If you are interested in learning more, or what it would cost, or what a pro forma looks like, or what's involved, or what the licensure looks like, you'll see there's a QR code here on this screen. I'd ask you to scan the QR code. That'll bring you to a sheet. You can fill out your name and phone number, and we'll have a key account manager, or we'll set up some time to show you how our program works and talk to you about what it would mean to your organization. It's doesn't cost you anything, and it's a great opportunity to say, hey, if we're looking at our options, what does this option look like? So we're proud to bring that service because we think dialysis patients deserve it. We see opportunities here with you as partners of ours and with the larger acute partners as well, and really look forward to finding ways to bridge this complete solution for these dialysis patients that really are kind of getting left out in a number of areas. So Ray, thank you so much for your time. I appreciate your insight, your expertise, and your partnership here. It's been great talking with you today, and thanks for sharing with everybody.
Thank you. I appreciate the opportunity to be here.
Thank you.
Awesome. Well, thank you so much, Ray and Steve, for a wonderful discussion, and for everyone for taking the time to join us today. We will be following up with a recording, so keep an eye out for that. And please have a wonderful rest of your day. Thank you very much.